Newshub can reveal more than 200,000 people are in need of drugs sitting on Pharmac's wait list. Medicines the drug buying agency said it would fund if it had the money.
And now all eyes are on this week's budget to see if National will keep its promise to fund more cancer drugs. Political editor Jenna Lynch has this exclusive report.
Lydia Pereira and Vicky Hudson-Craig, both hardworking, loving mums, both in their 40s, and both have cancer.
I've got stage 4 melanoma, which has spread to my heart.
They found a mango-sized lump in my stomach.
They also both rely on drugs not funded by the government.
When they said it wasn't funded, I think it was just terrified. I just remember, well, we just all cried. There was 3 of us in the room, we just cried.
Oh, look, I'm always pissed off, always. It's not something that you want to hear.
Both of the treatments they're taking are on Pharmac's options for investment list, basically a wish list of drugs it would fund if it had the budget, but it doesn't. So they each need to rely on fundraising $5,000 to $6,000 a month.
You know, hard enough just to buy bread and milk for some families, and asking somebody to come up with $6,000 on top of everything else that's going on for them, just living in general.
Having cancer, like on its own, that's enough to battle, but then to be constantly worrying about how you find that level of money just to stay alive is just, it's impossible. Right?
In December 2022, the number of patients expected to benefit from treatments on Pharmac's waitlist was 172,000. By March this year, that had grown by more than 50,000 to 228,000, a 32.6% increase.
We're the only country in the world that has a waiting list for medicines, and some of those medicines have been sitting there for 15 years or more.
I'm living proof that this drug can work, so why wouldn't you want that for me? Why doesn't the government want that for me?
National pledged on the election campaign to fund 13 cancer drugs. Lydia's wasn't on the list, but Vicky's was. She needs them to keep their promise.
Will that be funded in this year's budget? Because there are people right now that are relying on those drugs that are looking to you for help.
I'm not making an announcement about that today. What you have seen is that we had to find $1 billion more than anticipated simply to keep the Pharmac budget going.
You know, our lives are dependent on it, and that promise was a lifeline.
She wants to be here to see her little girl Ruby grow up.
I can't imagine having grown up without my mum, and I don't want that for her. It's as simple as that, really.
To her, this year's budget isn't just tax cuts versus spending cuts.
It's literally life and death.
It cannot get more serious than that.
OK, Jenna, Budget Week has officially kicked off, so what can we expect on Thursday?
The government is describing this budget as a tough choices one. Nicola Willis outlined today how they've been kind of shaking down the public service to find any saving they can. She said that ministers had identified 240 government programs that can either be trimmed back or canned completely to fund either new programs or the promised tax cuts. Now, Nicola Willis wouldn't be drawn on how much money they had raked in from that savings exercise, and after the bombshell out of the blue announcement last week that they were scrapping the first home buyer grant, she also wouldn't rule out scrapping other programs they hadn't campaigned on cutting.
New Zealanders will be surprised at exactly where so much of their money has been going. We have uncovered a layer cake of government initiatives, many of which we had never heard of before, which were absorbing tens of millions, if not hundreds of millions of dollars.
Now, when it comes to those cancer drugs, National did promise they would be funded from this year, but Nicola Willis wasn't willing to give the same assurance that she has been giving around the tax cuts that they will be part of this year's budget. She also would not be drawn on whether they were pushing ahead with targeting the free prescriptions policy to just community service card holders and superannuitants. That was how they were going to find the $70 million a year to fund these cancer drugs. So patients like Vicky will just have to wait until Thursday to see whether they need to keep fundraising for their life-saving cancer treatment.
Political editor Jenna Lynch live at Parliament. Thanks very much.